Good morning, everyone. Welcome to a seminar on preconceptional planning, that is, preparing for pregnancy and beyond, brought to you by Mom Plus. I am Dr. Smita Vats, and I am a practicing gynecologist at Gurgaon for about 10 years now. So this seminar includes the various lifestyle changes, the various dietary modifications that you can make in your daily routine so as to ensure that you have a healthy pregnancy resulting into a healthy baby. Motherhood is the most precious gift of God to mankind, and it is every woman's fondest dream to hold her lovely baby in her arms. Pregnancy is a landmark time in most women's lives, and while many women may conceive spontaneously without any planning, it is always a good idea to prepare in advance for this major change in life, especially when it has a major impact over your future life and health. So preconceptional planning and care includes the healthcare of women as well as men, with specific focus on health behavior and modifications that increase the chances of having a healthy baby. So it improves the chances of having a healthy baby by trying to address any relevant factors. So that brings us to the question whether preconceptional planning is really necessary or whether it really does make a difference. Well, the answer is yes. Preconceptional planning gives you an opportunity to take control of your life and choose healthy habits. Thus, it involves living well, living right, and taking positive steps towards a healthy pregnancy and a healthy future. Your preconceptional planning and care can make a positive difference to your health as well as the health of your child. Your medical health condition, the medicines, the habits that you have, like smoking, consuming alcohol, etc., can have an effect on your baby's development even before you realize that you are pregnant. Research indicates that about half of all pregnancies are unplanned, and couples don't learn about the pregnancy until it has already crossed 6 to 8 weeks. Well, by that time, the major organ formation of the baby has already started, and the foundation of vital organs like the brain, the spinal cord, the heart, the kidneys, everything has already been started to be laid. So whatever you're eating, whatever medicines you're taking, whatever you're drinking, everything has already started having an effect on the development of the baby. So it makes sense to plan your pregnancy in advance, to make the necessary lifestyle changes, and to also make changes in the kind of medicines or supplements that you might already be taking in order to ensure that the baby's development is smooth and the pregnancy is a healthy one. So many people ask us why they should be planning in advance for a pregnancy. Well, a pregnancy brings with it a lot of physical changes, and there may be a lot of physiological changes in your body which you may be able to deal with better if at all you already have an awareness about them, or if your body is well prepared for them. Any pregnancy also brings a lot of emotional turmoil. It brings a lot of hormonal changes which may lead to mood swings, which may lead to other problems if you're not already prepared for those changes. So planning in advance helps you to prepare yourself physically as well as emotionally for the coming pregnancy and the changes that you can expect, and the changes that will be there inevitably in your lifestyle and in your daily routine once you have the baby in your house. It also helps you to facilitate conception because it allows you to make the necessary changes in your lifestyle and in your sexual habits, which may facilitate an early conception. This is also an opportunity to assess any pre-existing medical or genetic conditions which might be there and which may be undiagnosed till now. So if at all there is, there is any diabetes or high blood pressure or heart disease which may not have been diagnosed by now, or if there is any other medical or genetic problem in your family which may need to be addressed before you plan a pregnancy, so then this is the right time when you have a preconceptional visit to a doctor in order to make those changes in your lifestyle as well as in order to treat those medical conditions and to take certain preventive measures that you can take in order to make sure that these medical conditions do not have a harmful effect on your pregnancy. So hence this is also a time to modify the medical treatments that you are taking, because some of the women who may be on medications for, say, suppose heart disease or epilepsy or bronchial asthma or any other condition, high blood pressure or anything. So certain medicines given in these conditions may be harmful for the development of the baby. And once you have started planning a pregnancy or once you are pregnant, some of these medications may need to be modified, the doses may need to be changed, or sometimes the medication itself may need to be changed, and you may need to switch over to safer medicines in order to ensure that these medicines do not have a harmful effect on the baby. This is also a time to review your vaccinations, because some of the preventable diseases like rubella, like hepatitis, etc. can be easily prevented once you have been vaccinated against them. But these vaccines may not be given to you while you are pregnant. Or sometimes, say suppose if you have received a vaccine for rubella, you may be asked to defer a pregnancy for the next 3 months because it is a live vaccine, and sometimes it may have an effect on the development of the baby. So hence preconceptional planning comes into play in this part also. So all this planning helps to minimize the complications in a pregnancy, and it also prevents any birth defects in the baby because of the medications that you might be taking, or because of any infections that might be resulting because of due to the absence of your immunity against them. And hence it helps to influence the baby's growth and health as an adult, because healthy pregnancies lead to healthy babies, and research indicates that the pregnancies that are well planned, the pregnancies in which the mother's nutritional and health status has been good, that results into babies who grow up to be healthier adults as compared to the others. For some people, getting ready for pregnancy may require a few months, while others may take longer or may need only a few weeks. Well, whichever category you fall in, preconception planning helps, and ideally you should meet your healthcare professional at least 3 to 4 months prior to planning a pregnancy. If that is not possible, try to give yourself at least 1 month of preparation before you get pregnant to start getting your body and lifestyle ready for pregnancy. A visit to a doctor may be a dreaded prospect for many people, but if you are already aware of what kind of questions you are going to face, what kind of medical examination you are going to undergo when you visit the doctor, then the visit to the gynecologist may not be such a scary experience, and your doctor would be taking a detailed history and doing a detailed clinical examination on you, and there will be a review of any previous pregnancy problems, because certain conditions are recurrent and may be more severe in a subsequent pregnancy. For example, high blood pressure, gestational diabetes, antiphospholipid antibody syndrome, etc. are the conditions which may attack you with a greater severity than they did in a previous pregnancy. And this preconceptional visit may be an opportunity for your doctor to assess your status at that time, and to take preventive measures so as to minimize the complications due to these conditions. You would also be asked to undergo certain blood tests and radiological examinations to assess your basic health status, and your immunization status may be reviewed, wherein various vaccinations like rubella, hepatitis, measles, mumps, etc. may be reviewed. And if at all you are not immune to any of these infections, your doctor may suggest you to take the vaccines for these, because these infections, although not so harmful when you are not pregnant, if at all you get them during pregnancy, these can be very, very dangerous for the baby and may result in birth defects and other problems in the pregnancy. Hence, it is a better idea to get yourself vaccinated against these infections even before you get pregnant. You will also receive advice regarding the diet and the supplements that you should be taking. Most often, a folic acid supplement is started by the doctor at least 3 months prior to planning a pregnancy, and the various dietary modifications which we will be discussing further in this presentation would also be advised to you. Of course, you would be advised to exercise regularly and to maintain an adequate BMI, that is the body mass index, which means that you should be an appropriate average weight when you enter a pregnancy. Of course, that should not deter you from planning a pregnancy if you are not the ideal weight, but it is always a good idea to be at least in the average weight range when you are planning a pregnancy, because being overweight or being very underweight can also cause complications. Also, they would be advised regarding giving up the addictive behaviors like taking of alcohol or smoking, etc. And if at all some people are in the habit of taking certain recreational or mood lifting drugs, they may be asked to stop those medicines. Although most pregnancies lead to happy outcomes, some medical conditions in the mother can adversely affect the baby's health and well-being by complicating the pregnancy. Some adverse outcomes cannot be predicted or prevented, but optimizing the woman's health before she conceives minimizes the risk of these complications. For example, optimizing blood glucose levels and thyroid status decreases the risks of abortions, birth defects, low birth weight, pregnancy losses, and complications during and after pregnancy, which may be arising because of an abnormal blood sugar level or an abnormal thyroid level. High blood pressure can lead to preeclampsia, eclampsia, low birth weight, preterm birth, etc. Hence, the blood pressure also needs to be addressed, checked and rechecked before you plan a pregnancy, and even multiple times during your pregnancy. Similarly, a woman with heart disease, epilepsy, bronchial asthma, etc. may need to modify the dose and the type of medications that she is taking, as some of these medications may have adverse effects on the baby's development and may lead to birth defects because of a harmful effect on the development of the various organs in the body. So your doctor may want to switch you over to safer medicines which may not be so harmful for the baby while you are pregnant. Another very important question is how to avoid infections and stay healthy, not only while you're pregnant but also before you plan a pregnancy. So the first step that you can take towards avoiding infection is to consider frequent hand washing during the day. Wash your hands at least 3 to 4 times during the day, especially before any meals. Avoid touching your face, eyes, nose, mouth, etc. with your hands frequently during the day, and avoid coughing or sneezing directly into your hands. Then keep your food items properly, wash them very properly, keep cooked food separate from uncooked or raw food items in order to avoid cross transmission of any bacteria or any harmful substances that may be there on the food items to be transferred to each other. Then avoid unpasteurized milk or milk products, which may again be harboring harmful bacteria that may lead to serious infections. Avoid raw or partially cooked eggs and undercooked or raw food. Wash your vegetables and fruits very properly, and cook your food very properly in order to ensure that all the harmful bacteria and viruses have been destroyed. Also, some people are very fond of gardening or doing the cleaning in the house themselves or taking care of the pets themselves. So these people should be taking care that they use gloves while they are handling the soil or handling the cat litter or their dogs or whatever pets that they are having, so as to avoid any transmission of infection from the pets to themselves. Some preventable diseases can be particularly harmful to the baby if acquired during pregnancy. Vaccinations against these are available, but you are not advised to take these vaccinations during pregnancy because some of these vaccines are live vaccines and may have harmful effects on the baby. As such, you need to avoid pregnancy for about 1 to 3 months after taking these vaccines. Hence, you should discuss your immunization status with your doctor and take the recommended vaccinations before you plan a pregnancy to ensure your health as well as to protect your baby from serious health problems. It is advisable to check your immune status and get vaccines for various diseases like rubella, measles, mumps, hepatitis A and B, and a flu shot, that is the inactivated influenza vaccine, and tetanus, diphtheria, atypical pertussis, etc. Of course, you will be immunized against tetanus again during the pregnancy, but it is also a good idea if you can take a shot before you plan a pregnancy. Taking a healthy and well-balanced diet is the first step you can take towards getting your pregnancy to a healthy start. Not only does it improve your health and immunity, it also builds your body's stores of nutrients and essential minerals required for your baby's growth. A healthy diet and body also maximizes your chances of getting pregnant fast, as it improves your fertility, since food and fertility are closely related. So you are advised to eat at least 5 portions of fruits and vegetables daily. That may be fresh fruits, dried fruits, fruit juices, or maybe frozen fruits. Vegetables may be cooked vegetables or in the form of salads, or whichever form you like them. Also take at least 3 to 4 servings of whole grains, cereals, pasta, bread, chapati, etc. 2 to 3 portions of protein sources like pulses, lean meat, poultry or fish are advised. So if for the vegetarian people, you're advised to take more of pulses, more of sprouts, more of maybe peanuts, chana, whatever you like, and take at least 3 portions of low-fat dairy products daily. This is not necessarily meaning that you should be taking at least 3 glasses of milk. You may be changing it into maybe curd or yogurt or cheese or whichever form you would like to take the milk in. Also consume a lot of iron-rich foods. And while it is important to know what you should be eating when you're planning a pregnancy or while you're pregnant, it is also important to know what you should be avoiding. Hence, avoid mold-ripened soft cheese because that may be harboring bacteria that may lead to serious infections. Also avoid large fish, for example shark, swordfish, mackerel, etc. because these may be rich in mercury, which may lead to bad effects on the development of the baby. Also avoid foods containing retinol form of vitamin A, for example liver, cod liver oil, etc. because that again may be harmful for the development of the baby. That brings us to the next question, whether any changes in lifestyle are required when you are planning a pregnancy. Well, yes, the most important change that you can make is to stop smoking as well as taking alcohol. Although effects of alcohol on female fertility are not very clear and it is not understood exactly how alcohol affects women's fertility, studies indicate that drinking between 1 and 5 drinks a week can reduce a woman's chances of conceiving, and 10 drinks or more decreases the likelihood of conceiving even further. During pregnancy also, alcohol increases the risks of low birth weight, preterm birth, miscarriage, fetal alcohol syndrome, etc. In men also, excess alcohol lowers testosterone levels and sperm quality and quantity. It can also reduce libido and cause impotence. The good news is that if you reduce what you drink, these effects can be reversed quite rapidly. Similarly, smoking spreads about 7,000 chemicals in your body and affects your reproductive organs, the egg quality and semen quality. Women who are even passive smokers are more likely to take more than a year to get pregnant as compared to women in non-smoking zones. The risk of infertility may be twice that in non-smokers. It affects how receptive you are to the fertilized egg, and smoking women reach menopause earlier than non-smokers. So all these factors indicate that you should be stopping smoking as soon as you plan a pregnancy. It takes about a year for the effects on fertility to be reversed once you stop smoking. Then various environmental toxins that you need to avoid when you're planning a pregnancy include BPA, that is bisphenol A, which is found in plastic containers. So women who use plastic containers to heat the food or to store the food in refrigerators should be taking a note of this, and it is always better to heat the food in a microwave in a glass container rather than a plastic container in order to affect the harmful effects of BPA. Also use paraben-free cosmetics to avoid the adverse effects on estrogen production, because paraben, which is found in many cosmetic agents, has been found to be having a harmful effect on the estrogen production. Hence, whenever you buy a cosmetic, just check the label for the presence or absence of paraben in it. Also avoid phthalates, which are found in plastic containers, and avoid ionizing radiation and X-rays, because these can affect fertility and have adverse effects on the baby's development once you're pregnant. It is also advised to avoid pesticides, toxic fumes like lead fumes or paint fumes, etc. when you're planning a pregnancy and also while you're pregnant. Another very important change that you can bring to your lifestyle is to keep a track of your body weight as well as to exercise regularly while you're planning a pregnancy and also while you're pregnant, because being overweight or underweight can adversely affect your fertility. According to a study, women with a BMI of more than 25 took twice more time to conceive, and women with a BMI of less than 19 took 4 times more time to conceive a pregnancy than the women who had an average BMI of 18.5 to 25. This adequate BMI can be achieved by taking a regular balanced diet as well as by exercising regularly. Because exercise gives you more energy, it keeps you fit, improves blood circulation to all organs of the body, including the reproductive organs, and boosts your fertility. It releases endorphins into your blood, which are natural mood elevators and stress busters, and this increases your chances of conceiving as well as to ensure that you have a healthy pregnancy. So undertake moderate sweat-inducing exercise for at least 25 to 30 minutes on at least 5 days of the week. You can go for any kind of a low impact exercise, walking, dancing, swimming, yoga, whatever that suits you, and you can continue this during pregnancy also, provided the medical conditions are acceptable. The most important supplement that your doctor would advise you before you plan a pregnancy is to start taking folic acid, because folic acid protects your baby against various neural tube defects. Neural tube defects are the defects in the formation of the brain and the spinal cord of the baby and may lead to serious anomalies like spina bifida, anencephaly, cleft lip or cleft palate. Folic acid also protects the mother against anemia, and the usual dose which is given in normal women is about 400 micrograms per day, which can be increased to about 5 milligrams per day in high-risk women. The high-risk women include women who have a history of neural tube defect in a previous baby, or who have a family history of neural tube defects, or women who are taking medicines against epilepsy, women who are taking medicines for diabetes, women with thalassemia or sickle cell disease, and also women with BMI of more than 30, or the ones who are obese. So folic acid can be taken through a daily supplement, that is a very small tablet which is advised by your doctor, and various foods rich in folate may be dark green vegetables, for example spinach, broccoli, asparagus, Brussels sprouts, etc. But the important thing to remember here is that folic acid gets destroyed by overcooking. Hence, do not overcook your food and try to eat your vegetables fresh in order to derive the maximum amount of folic acid that you can from these vegetables. But apart from these, you would be needing to take a regular medical daily supplement of folic acid. Another important question that many patients ask is how to ensure that they have a pregnancy as soon as possible. Well, the most important step that you can take for this is to keep a track of your fertile window. You should remember that sperms survive in the female tract for about 5 days, and the egg survives for about 24 hours once it is released from the ovary. Thus, the 5 to 6 days leading to the day of your ovulation are the most fertile. In order to calculate the day of your ovulation, count back about 14 to 16 days from the date of your next expected period to get the day of ovulation. And this method is useful in most patients who have regular cycles and is fairly well predictive. But in women who have irregular cycles and who do not know when the next period is going to be, or the ones who find this kind of calculation very stressful, it is also important that you should just forget about this and not be taking too much of stress about it, but engage in frequent intercourse. That is, almost every 2 to 3 days you should be having a contact during the month, so as to ensure that you have a pregnancy as soon as possible. Well, that brings us to the end of the list that you need to be taking care of when you're planning a pregnancy. But the most important thing to remember above all the other advices that you receive is to remember that you should be avoiding stress. Just think positive, because positive things happen to positive people, and stay happy. That is the most important part. Preconceptional planning is the best gift you can give to your baby, as healthy parents give birth to healthy babies. It gives your baby the best platform for a healthy start in life, as they are less likely to be born early or with low birth weight or with other serious medical problems and birth defects. We wish you all the best and happy parenting to you. From all the team here at Mom Plus, this is Dr. Smita Vats signing off. Thank you.